So it sounds like you're talking about viral persistence. And so, Jamie, there are recent studies suggesting long COVID is caused by viral persistence, ongoing inflammation in organs that could help explain brain fog in other systems. Right? I've spoken to long COVID sufferers who talk about the way the air in their home has become toxic to them, in addition to like the brain fog that you've mentioned. Can you talk about similarities between long COVID and ME/CFS? And I am going to ask you to tell us what ME/CFS actually stands for, because that's an acronym, correct? And it's a condition that people call, previously was known as chronic fatigue syndrome, but it is a constellation of more than that. So can you talk to us about the similarities between the two?
Absolutely. We'll take those one at a time. So ME/CFS is myalgic encephalomyelitis chronic fatigue syndrome. And it is characterized by this set of symptoms or kind of pathology called post-exertional malaise, in which when a person overdoes their activity physically or cognitively, they experience disproportionate flare of symptoms, often but not always with a characteristic 24-hour delay between the trigger and the symptoms. So it can be very hard for patients to understand why they went for a simple walk that they could have tolerated when they were well, and then the next day they can't turn over in bed, for example. So that is what I call the pathognomonic symptom, the symptom that identifies the disease. There are other symptoms required to diagnose ME/CFS, including cognitive impairment, orthostatic intolerance, fatigue that dramatically decreases somebody's capacity to live their everyday life and carry out their everyday activities. And about half of cases of long COVID have been identified as fitting the diagnostic criteria of ME/CFS. Now, as far as viral persistence and what's the similarity, the way that I think of these diseases is actually that the pathology often fits into three separate buckets. One of those might be viral persistence or fragments of the virus lingering. It could also be co-infections that arise after COVID. Another bucket is the damage that the virus initially did in the system. So a patient might have liver damage or pulmonary fibrosis, and that's what we're talking about there. And then the third bucket is immune, endocrine, and metabolic shifts. And that's sort of what I think of as ME/CFS. And those may or may not require the pathogen or fragments of the pathogen to linger for patients to experience those symptoms.